Hello, my name is Susan Linden. I'm a student at Cedar Crest College. I'm speaking on the topic of pediatric pain management, and I'm going to talk about this topic in relation specifically to the clinical question that I have here at the top of the poster. And the clinical question is this: in children ages 2 through 12 undergoing needle procedures, does the use of distraction techniques compared to using no distraction techniques reduce pain? Well, first of all, what is pain? The literature tells us that pain is a subjective experience. It involves the cognitive, the emotional, and the behavioral aspects of the brain. And so the brain plays a large role in the suppression of pain. And what that tells us for practice is that pharmacologic pain management is not enough because it doesn't address all of the aspects involved in the pain experience. Distraction is a technique that directs the attention away from the pain. The theory is that by shifting the attention towards something that is engaging or appealing, the brain is unable to adequately attend to the painful stimulus. The literature tells us that children experience inadequate pain management during medical procedures. What happens when a child has a poorly managed healthcare experience involving unnecessary pain? Well, what this does is really it sets the stage for the next healthcare experience. That child has even more distress and even more pain the next time that they need a procedure done. And the procedure is even more difficult to perform. And the procedures we're talking about are needle procedures, venipuncture, IV cannulation, lumbar puncture, cardiac catheterization, all the way down to IM injections and immunizations. Needle procedures are the most common procedures performed in children, and they are the most feared and considered the most painful. So questioning the gap between evidence and practice should be of high interest to nurses because nurses routinely make independent decisions in non-pharmacologic pain management. So I searched the evidence and I found that there was plenty of it to answer the clinical question here. I rated the evidence. I chose the top 3 studies and I put them here on this table. And the first study that I'm talking about is McCarthy et al. McCarthy et al. Study was a randomized controlled trial with a very large sample size of 543 children. This looked at parent variables and procedural variables related to IV insertion when parents were the distraction coaches. So what they did was they videotaped the procedures and they captured the parent-child interaction during the procedure, and they measured the parental performance of distraction using a tool which they themselves developed called the Distraction Coaching Index tool. So the unique aspect of this study was that they also measured cortisol response as a pain response. The most significant finding here was that high-quality distraction by parents resulted in reduced pain. Collar and Goldman performed what they call a critical assessment of the literature. So this was not a systematic review, but it was very systematically or meticulously, should I say, done. It looked at distraction techniques for reducing procedural pain. Now, it didn't look exclusively at needle pain. However, 30 of the 46 distraction trials had to do with needle procedures. And they categorized active versus passive distraction. They found no difference in the efficacy between the two, but overall, distraction of both types reduced pain in children undergoing procedures. Burney et al., now this was the crowning glory of the literature search because it was a systematic review in the analysis. It looked at distraction and it looked at hypnosis. Now, it did not meta-analyze distraction together with hypnosis, so we are able to look independently here at distraction for our topic. This was actually a revised and updated extension to a 2013 Cochrane review. And it included 26 randomized controlled trials for distraction and found that distraction significantly reduced child pain during needle procedures across all settings and ages. Now, however, it said that there was stronger evidence for the 6 to 11 age group. So what did the authors recommend? Well, McCarthy et al. Recommended that we engage and educate parents in the use of distraction. Collar and Goldman recommended that we make patient choice a priority, give the child a choice of what distraction method would work best for him or her. And Burney et al. Said increase the quality of research by increasing the sample sizes, by decreasing the risk of bias, and by consistently performing well-designed methodology. So overall, the answer to the clinical question here is yes, distraction does reduce needle procedure-related pain in children of our age group. This concludes my study. I want to thank you for listening and watching, and I look forward to hearing from you.